All right, what's up, everyone? Welcome back to Basically EMS. I'm Chris. We got Wade with us as normal, and two super special guests I'm really excited about. So if you guys maybe want to introduce yourselves, we can start here and kind of work our way around.
Yeah, my name's Nicolette, and I'm currently an ICU nurse within the Treasure Valley.
Cool.
And my name is Mohammad. I am a former critical care medic, and I am in my last year of medical school. I just matched into emergency medicine, so I will be an ER doctor here pretty soon.
Whoop, whoop. Almost Dr. Mo.
Almost Dr. Mo.
Almost Dr. Mo. Right on. Cool. So excited to have you guys talk a little bit about some EMS stuff because both of you have some EMS experience. So you can kind of bridge that gap a little bit, I think, for EMTs, paramedics, whoever's listening, new providers, whatever, about the stuff that we don't know, because we show up at the hospital, we drop people off, and then we never see them again or really hear about them again. So excited to get some perspective of what happens later. So first thing I want to know a little bit about how you guys got to where you are, a little bit about your healthcare journeys. I'd love to hear how that all kind of played out. For maybe somebody else that's thinking they want to get into this to get into nursing or med school or anything like that. So you want to start, Nikki?
Sure. My healthcare experience was very non-traditional, I'd say. I originally thought I was going to be a doctor as well, and that just didn't pan out for me. I initially was very, very nervous, and I thought getting into EMS would definitely help with that nervousness. And I think it did. I came out of my bubble. I was in EMS for about 2.5 years over here in Idaho. So I practiced as a basic for about 1.5 years, then an advanced for another year while I was in nursing school. So by the time I graduated, then I started as a medical and surgical ICU nurse. I feel like all of that kind of helped to create the foundation for where I am now. EMS was definitely a huge part in why I wanted to be in hospital. So it's a little bit about my story.
And then where are you going? Because you're downplaying a little bit what your eventual goal is here.
I eventually want to go to CRNA school and then get my PhD. I just love teaching. I think it's so much fun. Along the way, I started teaching here and doing like ACLS, PALS, all the BLS stuff, and then helping with all of the EMT classes. But yeah, CRNA I think is definitely where I want to end up, just being in the OR, being with your one-to-one patient. And I like everything very, very controlled. So being able to expect the unexpected and have everything prepared is more my jam.
Wait, I'm so curious. What's your PhD? Like, what do you want to do your PhD in?
Well, technically, it's just in nursing research. So just continuing on right now, like as I was going to school in nursing school, I was an undergraduate researcher. So I have 4 current publications, 1 in review, and I just want to keep it going. I think it's super fun, and potentially like working at a university and helping teach how to do research. I feel like there's a lot of gaps that we're not really addressing. So trying to find all those barriers and make something from it.
So would you say EMS was like exposure therapy to break that structure mold for you?
Oh, absolutely. I feel like I was able to see what we do well, what we don't do well, versus how it differs in hospital versus how does it differ on paper. Because when you're dealing with numbers, it's just numbers until you realize like these are people. This is actual situations that matter and they affect both pre-hospital and in hospital. So seeing how it all plays out together, I think was amazing because I had experience in all of those areas.
How about you, Mo? Tell us about your journey.
Yeah, my journey is a little chaotic. There's a lot that's happened in my journey. I've worn a lot of hats, and so it's kind of been a little crazy. It all started off essentially back in the day. So I knew I wanted to go into the healthcare field when my little brother was born. So he was born August 8, 2002, went into cardiac arrest just a few hours after birth. And I saw the neonatal team resuscitate him. And so they worked him for quite a while. And so they were pretty confident that he was going to end up having some brain damage. He was on full life support. And so at that point, you know, we were actually prepared for a funeral. They kept him on life support just until like the family can say goodbye. But he pulled through. After 18 days, he woke up out of the coma. After, you know, we were able to bring him home after a few months. Our living room turned into what felt like an ICU. he ended up starting to grow. He's now 22 years old and the biggest brat I know, and I love him to death. And it was really amazing to see that happen, right? And so like that catapulted a lot of us into it. So like my sister, for example, went into pharmacy, emergency pharmacy. My another sister went into special needs education. I wanted to go into the healthcare field, and I wanted to go to medical school eventually. And so throughout like high school, I kind of worked towards that. I went through like a medical explorers program where I did an internship in the ER for a few months, and I loved it. So I went off to college, and I didn't want to do the traditional like bio or chemistry route. So I was a very non-traditional person as well. I did finance as my degree. So my degree is in finance, which comes into play a little bit later. But so I had a finance degree. And during my second year, one of my really close friends, who's now an attending internal medicine physician, he was like, hey, man, you should become an EMT. And so there was an EMT class at my undergraduate university, and I was like, hey, you know, let me do it. Like, it'll be a cool little resume builder. I went to the class, and I accidentally fell in love. It ended up becoming the greatest thing. And so then I became a BLS instructor. I started teaching the EMT class and started doing all these things. And so I really loved it. I almost left undergrad to pursue paramedic school. But my EMT instructor, who I will give so much credit to, amazing guy, and he ended up saying, hey, no, you should just finish what you're doing, right? Like just continue and then go to paramedic school after. So at that point, I decided I was going to take my MCAT, apply to medical school. My first MCAT attempt wasn't great. I was dealing with a lot of really personal things at the time that made it really difficult. And so I don't think I was ready. And I'm thinking that it actually worked out pretty great that I didn't go to medical school at that point. Got into paramedic school, went to paramedic school, really loved that. And so this whole time while I was in that process, I was working as an EMT on our campus ambulance, which was a 911 response vehicle for the campus in the area. I was teaching BLS. I was teaching the EMT school. I was an ER tech at the hospital. I worked at the urgent care. And I also started up like this preventative medical team where I would go to music festivals across the country, and we would help like reduce EMS incidents by like, you know, having preventative medical staff within the group. And so I started off with like doing really small. It was like 8 people at our first festival, and then we ended up growing. My biggest event was in New York, where I had 105 people working under me. Wow. So there was like 5 managers under me and then 100 people under them. So I had about 400 employees or so like nationwide at all these different festivals. So it was super cool. And this is where I was really starting to like really fall in love with EMS. Went to paramedic school, did all my training with the Chicago Fire Department, really loved that. And so then I started working for a suburban fire department out of Chicago just shortly after that. And on my training shift, it was my very first day on the fire department, and I was in orientation, and the EMS chief like came up and he's like, hey, or the EMS coordinator, he's like, hey, there's a call coming in for a stroke call. He's like, we're going to pause orientation for a second. You're going to come with me. And he had his like own personal buggy. So we go out there, and I get on scene, and there was like this massive mobile stroke unit. And it was a full ambulance the size of a semi truck with a CT scanner in the back. Yeah. And I was just like jaw dropped to the ground. I'm like, what is this thing? And how do I get on it? And so they told me that I had to be a critical care medic. And so I worked for a few years in the fire department, got my critical care, went off and did that. At the same time, I was also then teaching ACLS, BLS, and PAL, or not PALs at the time. I got my PALs through my instructor through IMA. But I was doing ACLS and BLS at the time, and I opened up like a CPR company. So I was doing that. I was teaching simulation through the university, through their College of Medicine. So I was doing a whole bunch of stuff. And I was really drowning myself with like just keeping myself into work and not really pursuing the ultimate goal that I wanted. And that was that was me just trying to kind of suppress a lot of the personal things that I was going through and just not letting myself feel those emotions and what was happening. And so after several years, I finally decided to come out of the closet, took control of my life again, really like put everything back out into the table and figured out what I was doing. And then that was it. I was like, all right, it's time to go to med school. And then went off to med school, and the rest has been history. And I've wanted to do emergency medicine ever since.
Man,
you don't like sleep very much.
No, I never slept. It was horrible.
I need to work harder.
I know. I feel bad about myself a little bit right now, but it's okay.
Not even, man. You guys are doing amazing work.
It's a little intervention essentially for you, Wade.
Yeah.
That's what this all is.
It's a pretty elaborate move. You're getting me.
Yeah, it's getting a little hot in here.
Yeah. Cool. Yeah. So talking about your guys' journeys a little bit, and you kind of brushed on it a little bit, but was this your end goal? And it sounds like not really, but kind of maybe. But was what you're doing now your end goal?
Initially,
initially was this your end goal as you got into this, or not? And kind of what made you change your path, if anything, made you change your path?
When I first started in EMS, I thought I was initially just starting nursing school, and I really thought, oh, maybe I'm in the wrong field because this is amazing. It's so much fun. Like I felt like you're working. So I'm in my early 20s, but I was working with people who were in their 40s, 50s, and I feel like it's like high school all over again, but in a good way. You know what I mean? Like it's fun. You're running calls, you're doing things together. I'm the type of person when we're on shift, I want to be talking to you. You know what I mean? Like don't go to your room. Like let's hang out, you know? Because if you get to know your partner, then you trust them. Then they trust you to do things, and then it's a really good learning experience. But then once I started nursing school, I had started as a nurse apprentice in one of the ICUs in this area, and it was neurosurgical trauma. So it was just amazing to see all these different traumas that we would normally bring in from EMS. So seeing that, like, now we're in hospital, what are we doing now? It is a very different world because in EMS, you're confined to that box. You're confined to whatever is in that area that you can finagle, I guess, versus in hospital, you've got all your docs, you've got all your orders, everything's right there for you. So seeing that difference, I was like, ooh, maybe this is cool. This is where I want to be. But then once I started my nursing journey and actually started practicing, it was incredible to see actually how much scope that we have as nurses. And I was like, well, I can take this another step farther if I really wanted to. So let's just go for it. So right now I'm studying for my CCRN, which is the critical care nurse certification. And you have to have at least a year of high acuity experience. But if you can get trained on all your devices and do all the things like CRTs, renal replacement therapy, or all the fun like Impellas or the balloon pumps, just more things, then the providers start trusting you and you're just able to do more. So there's so much in hospital that you can do as well. We have advanced practice providers, the nurse practitioners. And you kind of mentioned to the mobile stroke units, like they can be on the mobile stroke units too. Or if you want to do ground nursing for transport, I thought about that too. Maybe some flight, I don't know, something cool. But no, I feel like there's so many opportunities. You don't have to pigeonhole yourself. And if you wanted to say EMS or in hospital, you could do it all theoretically. I mean, there's plenty of paramedics that I know that work in the ERs in our hospitals. So you may as well do what feels good, you know?
How about you, Mo? It sounds like you kind of had your path planned out to begin with, and then maybe took a little bit of a curvy line to get there. But it seems like that was kind of your end goal, was where you're very close to now at this point.
Yeah, I really, that was always the goal that I wanted to have, and I kind of struggled to get there at first. And you know, I'm so grateful for that. Honestly, I think that was the greatest little detour I could have taken. I really fell in love with EMS for all the right reasons, and I loved it. And I think it was probably the best thing that's happened to me, because going off into medical school, that paramedic background, that critical care background was unmatched. Like coming into med school, there was so much knowledge that was there already for some of these things. Now, granted, that touches on the teeniest, tiniest bit of what medicine is. And I was really, really overwhelmed with medical school being so much harder than I ever expected. No matter how much people try to prepare you, medical school is very, very difficult. The scope of medicine goes beyond anything that we would ever really imagine. But having that background as a paramedic was so helpful in like the little things that really helped me, like be able to take a good history and just like be able to recognize when something is life-threatening, when it's not, being able to talk to a patient and like get the information that I need in a really appropriate way, and like know what vitals are normal and things like that. So I wouldn't trade my experience for anything. But the ultimate end goal was to be where I'm at now, and I'm really glad that I'm here.
How does it feel to be, you know, like, because we've all had aspirations for what we want our careers to be, but like, you know, starting with like your history and like now you're kind of on top of that mountain and you're right where you want to be. Is it kind of, you know, like the reflection process hitting you harder on that at all?
It really is, because I just matched into emergency medicine on Monday. So at the time of this recording, it was just a few days ago. And by the time this recording comes out, I'll know where I'm going to be an ER doctor, which is crazy. And so like I find out tomorrow where I'm going to do my training. And so I'm in this really, really sweet spot right now where like I have something really exciting coming up on Friday, tomorrow. I have like graduation coming up in a few weeks. Rotations are like, I'm on my last rotation right now, and I get to just kind of sit back and like just look back at my last 4 years of med school, and seeing and being able to reflect on what happened during those last 4 years. And it's really, really cool to like, it felt like a decade. It also felt like a snap of the finger. Like it was so fast and so slow at the same time. The days were really, really long, but then the weeks and the months were really short. And it really was awesome to be able to accomplish the things that I want to accomplish. And like, I'm from Chicago, but coming to Boise for medical school probably was the best thing that's happened to me, because I was really able to focus and achieve everything that I wanted to achieve, and do things that I didn't think that I was even capable of doing while I was here. And so I kind of built this foundation for myself. Now I'm going to go off to residency and be able to do everything that I want to do, and hopefully be able to, one day become an EMS medical director and stay within that field. I think is super, super cool. So it's been really cool to reflect on what's happened, and to like be proud of the position that we're in, and then also look forward to like what's going to come next.
It's very full circle, very satisfying ending to that story.
Yeah.
Don't let us down.
No I'll never, just for you, Wade, I'll make sure of it.
Wade's going to be watching your career very closely from here on out.
But also, you got to post more on Instagram so I can really.
I will. I'll make sure of it. Friday, tomorrow.
Perfect.
You'll see.
Yeah, so we can find out where you're going.
Exactly.
Where you're going to go be a doctor.
That's exciting.
It's super exciting.
It's very exciting. Yeah, I'm super excited.
So how about during your journey? We'll start maybe with Mo. Like, what challenges do you feel like you had during that time, and kind of what did you do to get through those challenges? Like, how did you get past those things?
Yeah, so there was a lot of challenges that I had to face at every step of the journey, and there's so much to overcome, and so it was like really trying hard to figure out like what I needed to tackle first to get to where I needed to be. So the very first challenge that I ended up kind of encountering was the fact that like my MCAT was not great. My first, for those who don't know, the MCAT is the medical college admission test. So that's the test that you have to take to get into med school. And my first attempt just didn't really go so well. I think that, again, at the time I was really struggling with my own personal struggles. And so I don't think that I really allowed myself the time to like really sit and study and do what I needed to do. I just kept putting myself on this go mode of just working all the time. And so my MCAT really held me back. So I took it, didn't do well on it, didn't get any interviews into medical school my first round. And so I was really bummed, and I almost gave up. I was like, wait, well, maybe I'm not cut out for this. Maybe this is not what I should be doing. Maybe I should just become a paramedic, and that would be easier for me because I already know I have my acceptance and I don't need to worry about going that next step. Ultimately, I know that was the wrong mindset, the wrong framework to have. And I was really able to make sure that like I reframed my mind, but it took some time, right? So I took that detour, went the paramedic route, continued to work through it, and one challenge after the next, I was like slowly starting to overcome it. For example, I have difficulty seeing at night. I have a really rare disease where it makes it really hard to see at night. Becoming a paramedic, a lot of that it requires that. And so even overcoming those challenges within EMS, I figured out how to do it. And my chiefs and my lieutenants and my partners were all really great. And like I always had a flashlight with me. My lieutenant would always carry a big light behind, and we worked through it, and we made it good. And so like, I overcome the challenges I needed to for EMS. And then when it came down to like really taking control back of my life, I kind of mentioned it a little bit earlier, but once I came out of the closet and realized like, okay, like now I authentically love myself and who I am, now I can really go after the career aspirations and the personal goals that I had, and that's when I really started to take back control. And I, started studying for the MCAT again. I did really well that time around. Applied to medical school, got multiple acceptances, and I ultimately realized like that first MCAT attempt was like had no impact and had no bearing on my life. In fact, it was probably really good because it forced me into EMS and really changed my mindset on things. And it was really, really awesome.
I think that can be really huge for people, especially people listening to this, to know, because medical school is going to be a whole different level, but even paramedic school is really challenging to get into, or the fire service is really challenging to get into. And I've known a lot of people that like get to a point they just kind of give up.
Yeah.
And that's, you can't, if you want, I think it was Dan Cole, Captain Cole, who we know, he's a Meridian fire captain local here, that helps us. We do a fire interview course, right? One of the things he tells all the students is the only person that's going to stop you from getting your dream job is you. And the only 100%. Way you don't get your dream job is by you giving up, right? 100%. If you keep working at whatever it is, maybe you have a poor MCAT score, that doesn't get you where you want to go, but you keep pushing through it. And it sounds like you had the wisdom to figure out like maybe there's some personal stuff I need to that's kind of holding you, even if it's not consciously holding you back, right? There might be some of that too, which is really cool to hear. You're able to work through that to get where you wanted to be.
And it really is like genuinely so true that like the only person to stop you from accomplishing anything is yourself. Mm-hmm. The only person. And if you want to achieve something, like you can do it. You just got to get yourself in that right framework, and you could surprise yourself. I've surprised myself many times where I'm like, I did things that I didn't think that I was capable of. And as you keep pushing yourself the next boundary over, you start to really realize how much you're able to grow. And then suddenly, like, any challenge that comes your way becomes like, oh, I can handle this. This is easy.
Been there, done that
Exactly.
kind of thing. Yeah.
Yep.
Yeah. Unfortunately, mental resilience comes from experience,
It
you know,
does.
and like you got to break yourself down a few times and identify your own weak points, whether that's something I've got to overcome personally or career wise, you know, in order to build that. Okay, now we can keep moving forward. Just a little grit goes a long way.
And medical school will break you down over and over and over again, but you overcome it.
Yeah. Do you feel like the pause that you had to get that other experience, do you feel like that was really vital in medical school, of like having a little bit more life experience and maybe somebody who just got their undergraduate and got accepted right away?
Yeah, you know, like I will say that I'm in a class with really intelligent, incredible people. But it's a wide spectrum of people in my class, right? We have there's one or two other paramedics in my class. We have some nurses in my class. We have some previous pharmacists and PhDs and whatnot. And then we have people who I had one classmate who like started med school at 19 years old, which means he had to graduate high school really early. He had to graduate undergrad really early. Like, I mean, like that to me was insane, right? I started at 27. So to start at 19 was definitely kind of wild to me. But really, like when you see the people who have had that experience before, like it really came out in like during like patient encounters and experiences, like knowing like how to really interact with patients, and like, you know, how to ask the right questions to get that. And that's hard to do, and it takes time to learn it. And so when you have that EMS background, it really just brings that all to the forefront, and you don't have to worry about it, right? Like at that point, I didn't have to worry about learning how to frame things for a patient to understand what I'm saying. I didn't have to learn, figure out how to ask the right questions or what vitals are normal. I was able to put all that to the side and say, all right, what do I need to learn now in medical school to make me a doctor as opposed to being a paramedic? And so I got to put that, like that was already in my back pocket, and it was super helpful.
Yeah, we see that with EMT students, like sometimes, and you know, having FTO too, you see like a brand new EMT, like if you say your name to the patient, that's the goal. Right? Like when you're brand new to this, like that is our line that we're looking for initially. Like, can you say, hi, sir, my name is this. What's going on today? Golden, right?
Yeah.
Like first call, and maybe we forget that like doctors have to start at that same
Yes.
spot somewhere. Nurses have to start at that same spot somewhere. And so you kind of fast track that, it sounds like, to get in the medical school realm.
Really. And also like, it's kind of interesting because when you're an EMT or a paramedic, you almost just expect like, oh, they're in medical school. Like they've got to be super smart and whatnot. But it's like, you have to realize like they're in medical school. They don't require any of that training previously. They are learning how to take a blood pressure during medical school. They're learning how to ask a patient the same questions that you learned all the way back as an EMT in medical school. So I think there's always like this little bit of a bias. Paramedics just expect like these, student doctors to like know these things. And it's like, well, there's a lot of them who don't, that they're learning it for the first time.
Would you say it's similar for you, Nikki, on that, like with nursing school, like how EMS kind of sets you up for kind of putting, okay, I know these things, I can now focus on this?
Oh, absolutely. I don't want to diss nursing school, but I feel like EMT school is harder than nursing school. EMT, like you're learning all your basics. You're learning how to talk to a patient. When in doubt, when was the last thing you ate?
Yeah.
But versus nursing school, it's very niche. It's more so you're learning more in-depth things versus EMTs a little bit about everything. And I feel like that kind of similar to paramedic school, even though I didn't go through it. But just speaking on the fact that there's just a lot more to know because you have to be prepared for anything. Nursing school, you have that doctor, you have somebody else to fall back on. You're always going to have more help versus like EMS, you are the help. So figure it out type deal.
Yeah.
Do you feel like EMT school is maybe more practical than nursing school? Nursing school is more of like a cognitive kind of book related knowledge, where EMS is more like, I mean, our book knowledge, I feel like, is not what a nurse is, but we are trained to put it into action, I think, a lot more than nursing
For
school
sure.
does. You feel like there's maybe a little bit of that?
Again, I feel like there's a lot more amazing EMTs and amazing paramedics that I've worked with versus there's some nurses where it's a little scary. I'm like, I don't know how you passed your NCLEX. Like, I don't know. But nursing school, I feel like it's just memorization. If you can pass the test, anybody can be a nurse. But I feel like it takes a special person to be an EMT or a paramedic. They need to work on the fly, like think of something now. You need a tourniquet. What can you use as a tourniquet? Versus, oh, let me just go grab something from the wall. Let's find what we have already. EMT, there's a lot of critical thinking, and you're on a limited time. Ideally, you don't want to be sitting at somebody's house for an hour or 2 hours.
Right.
Versus, I have all the time in the world in hospital. We'll figure it out. So.
How about you? Challenges through nursing school? Any challenges that come to mind, and how did you get past those?
My challenges were very different. I feel like a lot of it's mental because we have that mentality of nurses eat their young. And I think it's very, very true. When I was first applying, nursing school is very competitive no matter where you go. And I was told, well, you don't have a perfect GPA. You don't have all this experience. There's nothing that you have to show for yourself. You're not going to get in. But I think if you have that realistic mentality of, okay, there's a possibility I won't get in, but let's just go for it anyways. You don't know if you don't try. So I got really lucky that I did get in my first try. But once you're in, then we started our clinicals, and then the nurses don't trust you. And I'm like, okay, well, how am I supposed to learn if they don't want me to touch my patient? So then it's working around like, let me ask questions, let me get to know you a little bit better, and then they let you start doing things. But even then, you have a different preceptor every time. They don't know where your skill set is, and then you're starting from scratch every single day. So there's more challenges in that aspect. Also, even though I had some experience as an EMT, in hospital is a lot more different because you're knocking on their door, but you're going to walk in anyways. You know what I mean? Like, it's a false sense of privacy. And then you're very invasive. Like, we're going to be touching our patient. We're going to be doing our full head to toe no matter what's wrong with them, just because you're learning. You have to. And you have to be good at getting comfortable with being uncomfortable. And I think that's very, very hard, especially for nursing students who have no experience. And that's okay. Like, everybody starts somewhere.
Yeah.
And then moving on, by the time I was getting ready to graduate, I'm like, uh-oh, I'm almost a nurse and I don't know what I'm doing. Like, I've always had a preceptor, you know what I mean? Like, there's always somebody who's right behind you telling you what to do or making sure you don't mess something up. So by the time that you're actually a nurse, like, I'm lacking the ability to critically think or feel confident in my abilities because I've never done anything for myself quite yet. So then that added on another layer of pressure of ICU is very competitive. New grads don't start in the ICU. You have people who are more experienced who are getting that experience in order to get an ICU. So I got really lucky. It's all about making connections. I feel like is the biggest challenge in all healthcare. I feel like it goes for. It's making sure you put yourself out there. Whenever I have conversations with anybody in healthcare, people give me crap for it because, I don't know if I can say that
That's
word.
fine.
Okay. But treat everything like it's an interview. Talk yourself up. And I know it gets really uncomfortable. It gets really hard to do. But I think it makes it that much easier if you know your worth, you know how to market yourself. Then people are like, oh, that's a name I want to watch out for. So when I applied, I got lucky. I got the last position in this area. But then when I was first starting out, I had several experienced nurses tell me point blank, you shouldn't be here. New grads don't start in the ICU. So then there's this added pressure of like, okay, I'm learning how to be a nurse. I'm learning how to critically think and then take care of the sickest patients in the hospital. It was all like, it was super scary. But I think adding on to that thing of making sure you can market yourself, really know who you are. I had sticky notes that I would put on my room or put in the bathroom. Just like, it sounds stupid, but like, you're smart. You know what you're doing. You have experience. You have value. And making sure that nobody can tell you otherwise, that's really what's going to make you unstoppable, no matter how much or how little experience you have.
Yeah, I think that you guys probably had the same experience as brand new paramedics like that. That imposter syndrome is huge in everything here, for sure. And that's something I think we've all probably outside of just nursing, I think everywhere in healthcare, like, is everyone, everyone has experienced probably a similar thing of like, you really gotta, the positive affirmations, like, you got to build yourself up to go, because it's scary when you're EMT to, I'm sure doctors are the same thing, right? Like I know
Oh, yeah.
me personally as a medic, like it took like 3 years before I didn't show up just like, oh, I hope I don't get what, you know what I mean? Like just terrified that something bad is going to happen because I wasn't ready for it yet. Yeah.
Because you have patient lives in your hands. Like,
Oh yeah. Yeah.
this is it's not a joke, right? Like once you're off by yourself, like you don't have that person behind you making sure that you're doing everything right. And so it does become really scary and really challenging, and you have to make sure you know your stuff.
You know, you said a few times that you got really lucky. To your credit, you know what they say about luck. It's just a fallback. It's a byproduct of preparation. And so give yourself some credit, you know, like you're where you are because of the effort you put forth, and it shows. Just 2 cents on that matter.
Big time agree. Like, you know, everybody else is doing the same thing. It's not that you were lucky. You were just, you know, in some ways better.
I don't hear about new grads being in the ICU, so I'm like so impressed that you're able to get that. It's not luck. Like it really is like you putting in the effort and you showing off who you are that gets you there. Like that's not luck at all.
Give yourself some credit, girl.
Yeah, 100%.
One thing I thought was funny too that I want to touch on that maybe you guys had similar or different experiences, but about like the new nurses, they don't trust you. My first paramedic clinical in the ER, like I walked in, they're like, you're a paramedic student? I was like, cool. And they just took a bunch of IV equipment and shoved it in my hand and said, 17, 19, 22, please, they need IVs, and walked away. It's like, I've started one IV on a real person my whole life, and it was just very different than what you got apparently is. And maybe it was just, that was in California at a hospital that would have 12-hour bed wait times because it was so busy. And so maybe it was just a different thing than the hospital system that you went to, but very different for me as a paramedic. I don't know if it was similar to you guys.
Very, very. Like I walked in shaking, you know, first big ER, and they're like, okay, all of those rooms, they need IVs. I've got to go over here and do rounds on this people. It's like, oh, okay, cool.
Yeah.
And they, for my knowledge, they went okay. I left, you know, too soon to find out, but you know.
I do think that that's interesting though, because I've had kind of similar experiences to Nicolette, where it's like, you know, in medical school, you almost like when it's time to do like a new skill or a new task, it's like they always tell us like, you know, if you've seen it and someone asks you like, hey, have you done this before? You're never supposed to say I've never done it before. It's always I've seen this happen before. I would like to do it and then have you guide me through it. Because if you keep saying like, I've never done this, they will always just be like, okay, watch it this time. And then every time it's watch it this time. And like, they don't want you doing those things. And so it's like, I've kind of had similar experiences like where they almost like don't want you to do it. But I will say the difference is like in medical school versus paramedic school, there was like, it felt like there was no coddling at all. It almost felt like very boot camp style. Like there was one instructor, as soon as she walked in the room, you sat upright in your chair. Your phone must be off the table. Like there was no messing around. Whereas in medical school, I think because maybe it's just so much longer and there's time to do it, but there's a lot of coddling of like really just like making you feel like, all right, like you got this, like we can do this, blah, blah, blah. And it definitely was a little bit of a different feel for medical school in that regard.
That sounds so encouraging. That was not what I had at all.
Medical school is very, like they really do want to keep you in, you know, like there's tens of thousands of people who apply and only hundreds or of thousands that get in. You know, the acceptance rate's like, I think 20% or something of the overall. And so like, you know, if they pick you, you know, they're investing in you and they want to keep you in there. So they're going to do what they need to do. Obviously it's really tough and it's really hard and there's just no getting past it. If you just can't do it, if you don't make the cut, you don't make the cut.
Yeah.
But medical school will really help guide you and really make you feel comfortable and really, because there's so much imposter syndrome and they really try to kind of counter that.
Yeah. It is funny to hear the different. And that's just, I think EMS paramedic schools in general is just fast paced. Like you better keep up or you're going to get left behind. And, you know, I feel like we're better about it teaching here than some schools, but like there just isn't a level of like, we'll help you where we can, but like you got to keep up. You know, we can't hold your hand too much. So you guys being where you're at, going through the schooling you've done, do you feel like there's any personal attributes, anything you guys had that really helped you to succeed? Like any classes you took that helped you get ahead, or you know, study tips you could share with students that maybe want to be where you're at here in a couple of years? Anything you guys could share on that front?
I'd say, like me personally, just in my regular life, I'm introverted. And I feel like when you're in healthcare, you don't have that privilege. You can't be introverted. So I feel like it's truly a fake it till you make it type of deal. You need to be able to talk to somebody, ask them like, hey, like, how's your bowel movements going? You know what I mean? If you can get, again, with the being comfortable with being uncomfortable, I think that makes it a lot easier. If you talk to them like it's a normal conversation, like people will tell you things. You'd be very surprised. I'll have patients where I'm just drawing their blood and they'll be telling me all the tea of like what's been going on the past 20 years. I'm like, whoa. Then it gets exciting and it makes it more fun. But I'd say another thing with studying is like, I was the type of person where I like memorize the books, but as long as you can keep notes somewhere, something referred back to, I still look at my notes from EMT school. And like, even though I'm an ICU nurse, like doesn't make me better than an EMT. You still need to go back to your basics and know what you're doing. So I think those are my two big takeaways. Also, I would say always have an inquisitive mind. The people who stop asking questions are the people I'm concerned about. You're never going to know all of it. And I think especially as a brand new EMT, keep asking questions. Let's debrief the call afterwards. What went well, what didn't? Even if it's just a basic, my finger hurts at 2 a.m., what else was going on? Because clearly they thought that was an emergency. Or every old lady that falls, like every ground level fall is a little bit different. Is it because they had a really bad UTI? Is it because they were super delirious? Did they change new meds? How is that affecting all these things? Like if you can start to understand the why, it makes it that much easier when you get sicker patients and you're like, whoa, I have no idea what just happened. As an EMT, I'd say another great thing is like learning your meds. Even though you're not really giving a ton of meds, if you can be an excellent partner and know, oh, hey, like this person's having difficulties breathing. I know we're going to try doing a neb, then we're going to try doing this, and then maybe I'll go pull this from my medic. But like having that anticipation of what's going to happen next makes you so much stronger, and it makes you the type of person that people want to work with. So
Cool. How about you, Mo?
I would say that I think like you need to have you need to gain that level of like perseverance where like you can overcome the challenges that are put forth in front of you. That takes time. That takes a lot of hard work, a lot of introspection to like see what your shortcomings are and really like learn how to overcome those. But once you can get to the point where you're just like, you know, constantly pushing yourself to the next level, you'll start to realize like you can overcome anything that comes your way. And so whether it's EMT school, paramedic school, nursing school, medical school, like you'll overcome those challenges. And I think for studying, you know, these topics are hard, right? And like you're going to keep learning so many different things, and asking questions constantly is so important because I agree with Nicolette 100%. If someone stops asking questions, that's the person I'm worried about because there's so much you don't know. There's never a time where you can really stop asking questions. I mean, there's a reason why there's 134 specialties in medicine, right? Like there is a doctor for there's some doctors who specialize in a single disease, right? Because there's just so much to know about that one disease. So always have an inquisitive mind. I totally agree with. I think when it comes down to like studying and the different techniques of studying, like actual practical studying, there's two things that have been found to be really, really helpful. Number one is actually testing yourself. So practice questions. Practice questions have been found to be the best way to test your knowledge and to improve that knowledge. You take a practice exam, you look at the questions, you see what went wrong, why you got it wrong, and figure out, you know, how to fix that for the next one and keep going. So doing practice questions is over study after study has been found to be one of the best ways to actually improve your knowledge. And something else that's really, really helpful, that's like about a step down from helpfulness, but it's still probably one of the top things to do is like spaced recall. So things like, you learn a topic and you really like keep spaced repetition now, where it's like I see it every 5 minutes or 10 minutes or whatever, and then I don't see it for another day, and then I don't see another for another 5 days, and then 10 days, but you're constantly bringing it back. And so one tool that's super helpful that I feel like medical students have gatekept is this software, this application called Anki, A-N-K-I. So Anki is it's just a really basic thing that you can really make really intricate, but at the surface level, it's just a flashcard system that works on spaced repetition, where you have a flashcard and you say whether you didn't know it, whether you knew it okay, whether it was like or it was like easy. And so based on that, it'll space out the next time it shows you that card. And so like you'll see it after 30 minutes, and then you'll see it after an hour, and then you won't see it for another day, and then it becomes learned, and then you won't see it for another 5 days. And then if you at 5 days it comes back and it was good, then you won't see it for another 10 days, right? But let's say then it comes back after like 30 days and you didn't know it, it's going to put it back into your repeat pile. And so medical students have known about this for years, and this is what gets most medical students through medical school, and I feel like we've kind of gatekept it. And I want
I've
that.
never heard of it.
Yeah,
I've got so much beef right now. You have no idea.
Anki's amazing, and I want more people to use it, and anyone can use it, right? And so you can actually download like decks. So like you can look up like nursing Anki decks or like medical school like MCAT decks. I guarantee you, if you look up like EMT Anki decks, you'll find something, and you can just download them, import them in, and there'll be flashcards there.
Yeah, I didn't know it was a thing, but I used Anki when I was in nursing
Yes.
school. So there's, for all you guys who want to be nursing students, there's plenty of nursing decks.
Sure there
like
is,
you will
yeah.
find them.
Nikki made 6 of them. And there are 962 flashcards on average.
Well, I mean, yeah.
I mean, I was using your EMT notes to teach people. So for the record, you,
Oh,
you did a great job with those. For the record,
Oh,
Yeah,
thank you.
we hold you in very high regard. I don't know if you were one of our first advanced students. We did the online advanced program, and Nikki was one of the first people that went through it, and I was so excited because I knew if it sucked, I was going to hear about it. She was going to go through a really, really fine-tooth comb and find what needed to be, and I think you would send me
Oh,
like,
I made you a document.
Yeah,
I was
yeah,
like,
yeah,
this,
of
this,
stuff,
this.
and-
There's a typo right here. This answer is wrong.
and it was perfect. It was perfect.
Yeah, I guess another thing to add on for like studying things, I was the typical person. I didn't like to study in groups. That just didn't really work for me. But if you can like teach your dog, talk to your stuffed animal or something, or even if you don't want to talk out loud, if you just get a whiteboard or a plain sheet of paper, be like, okay, we're going to go over anything that can cause chest pain, and let's just brain dump it. Then you can go back to your notes, find things that you're missing. That worked really well. Or if you're the super competitive person like I am, just go ask your peers questions. Not making them feel stupid, but as long as you can ask them questions and understand, like, okay, let's go deeper, and then you're recognizing what the theoretical answer would be, it helps you to retain it so much more. Or have somebody else ask you questions, because I feel like if you get the answer wrong, there's nothing better than being wrong that makes you never forget it again.
That's true.
yeah.
Yeah. I would 100% agree if you're competitive. My medic school when I was going was like an hour and a half drive each way. I had to commute.
Jeez.
And so there are a couple of us from a similar area. So we would all meet up and we would carpool up together. And on the way up and on the way back, it was just rapid fire. How can I make them feel stupid and make myself feel really smart with the questions of what I read about or what I learned about? And I learned probably more in those 2 hours of commuting every day than I did in class, because we just were, it was just, I mean, just us being hyper competitive, wannabe firefighter paramedics, right? That's the people that are drawn to that, and us just trying to stump each other. Like, we learned so much on the way up, and we would come up with cool little things of like, oh, here's a cool easy med math trick, and we would share that with each other. And I found those questionings of your peers massively helpful for learning this information.
I had a similar experience with that. Like, my now wife went to medic school with me, and there was no greater feeling than like quizzing each other, and then she'd get it wrong and be like, no, idiot. And then, like, so we've always joked the basis of our relationship is just calling each other names, because that was how we studied well, you know, is like holding each other accountable. Like, we need to spend the time, but I'm competitive enough, you're competitive enough, I'm going to make fun of you if you're wrong. And then when you get made fun of, I will never forget those moments. You know?
Absolutely.
And now that you have a baby, is it like, did you change the diaper? No, idiot. Right? Do you
No, it's
carry
more
that on?
so of like, I think I'm busy during that time. And she's like, you don't know when? It's like, I'm for sure got work stuff. I don't know.
I will make a quick comment though, like for just people who are listening to remember, like, take what we just said, where we're going to ask our peers questions that we know. And so if you get asked questions that you don't know, don't let that discourage you.
Oh, yeah,
Because
yeah.
I've been on that side where it's like people will ask you a question, I'm like, I don't know that, right? And you almost feel like dumb for a second. But the reality is you can then turn around and ask them a question that they don't know. So never let that be something where it takes you over, where it's like, oh my God, I don't know what I'm talking about. This person is so smart and they know so much more than I do. Because the reality is they're just asking questions that they know.
Yep.
There's still a lot of things that they don't know as well.
Flip the perspective and make it a drive
Absolutely.
instead of
Absolutely.
a beat down.
Yeah. Have that. Yeah. Like you said, flip the perspective. And you kind of mentioned it earlier too. Like, like you should want to be asked questions so you don't know, because that's how you grow. If they're asking you questions and you get everything right, then what are you learning? How are you growing? But if your peers ask you a question, or like, you know, if you're an EMT and you go on a call and you have no idea what's going on, it's scary. But after, sit with your medic, talk to him, you know, maybe you can talk to the nurse or the doctor at the hospital. And if you stop being scared of that and start being excited about it. And I've definitely found there was a you know, like a switch that was flipped for me as a paramedic of, I started to think those were my favorite calls, where we walked out with my partner like, dude, I have no idea what just happened. Like, what do you think is going on? Right? At first that's terrifying. But if you can have that mentality of like, that's how I grow and learn, then those become really exciting. And then you just continue to be a better provider.
Absolutely.
The calls when you walk out and you're like, well, that could have sucked. You know, like,
They
Or
didn't
it
die on
did.
our way
Yeah.
here. So we
Yeah,
did okay.
exactly.
We did okay.
yeah. As long as they make it to the ER, it's fine. That's your
Exactly.
problem.
That was my problem, right?